My name is Maurits van Pelt, and I work for a Cambodian NGO, non-governmental organization called MoPoTsyo, Patient Information Center. I work with patients with chronic disease, mainly diabetes, high blood pressure, people with cholesterol problems or early signs of kidney disease, in order to help them cope better with their disease in the local circumstances of Cambodia. It's a low-income country. We have, like many organizations, developed our own database. That's also because I think the kind of information that we need is not standard available, because we want to know how people are doing, and we work with these low resource communities, marginalized communities, urban slum areas, rural areas, and we want to know urine sugar, and we want to know blood sugars that people have, and people have to measure their 24-hour urine that they have to collect. So there are things that not usually are standard in data collection. So ICT, we use it for entry of those kind of new data into our system, and then trying to develop what I would call a population-based approach to non-communicable diseases. We know these kind of things for other health problems, but not yet some for non-communicable diseases. So ICTs we use for that, and we use it also for research that we do with regards to sending SMS messages to chronic patients, so to improve their adherence and give them lifestyle messages. So that's another example.
Great.
That what people sometimes see as a problem is actually your opportunity to find, to build your solutions on. So what seems overwhelming and what puts people off, if you approach it from another way, it can also be the part of the solution. And I think the discussions here put me back many years ago in Cambodia, when we were looking at how we're going to do this. And so I hear people who are now at the beginning to think about what can we do. And I say, oh, this is not at all an issue if you see the opportunity that exists as well. People often think that the lack of human resources is a main issue. And if you work with patients themselves, and if you have found a way to engage them, then they become part of the solution. And so that is a key thing. I realize that everybody is struggling, that we cannot reduce health to just some simple biological indicators about blood pressure and blood sugar. People are looking for health, and they spend money on that, and anybody who is marketing to those people will find interested buyers. And so we have to be able to measure what people are actually looking for, and we have to satisfy those needs. So we have to look at health in a different way.